Hello everyone, my name is Chen Xinzhi. Today I would like to talk about my research project. My topic is a review of music therapy clinical efficacy in decreasing dementia-related depressive symptoms. Here is my list of content. First, I will show the statistics about current clinical situations, which indicates the need of home healthcare and the importance of music therapy. Next, I would like to share my simple summary of past music therapy various clinical appliances. And then I would like to introduce worldwide dementia situation and recent studies about music therapy to dementia. And in final, I will make my conclusion in discussing research gap and make a suggestion to future studies. So let's talk about the current clinical situation first. In the current clinical situation, need of home healthcare program has increased significantly. From the chart on the slide, we can see that the domestic applicants of home healthcare program have 10 times over the past 5 years, from 2016 to 2021. Besides, most of the applicants are patients with severe dementia. They are mostly kept with drugs and expensive assistive device, meanwhile suffering an irreversible deterioration of brain's function, resulting in less communication and cause more brain degeneration. Thus, to tackle the severe situation, effective non-pharmacologic therapies do serve as a powerful and innovative way to better patients with dementia, which hopefully can enable them to have a new way to maintain health, brain activity, and decrease deterioration in cognitive function, to help patients reach better life quality and lessen the burden of caregivers. So, how does actually music therapy works in clinical circumstance? In fact, in terms of current clinical appliance, music therapy has been proved effective in helping patients with brain damage. Music therapy even works from many different theoretical orientations, such as reaching functional-oriented goals or working from psychotherapeutic framework to improve patients' emotional experience. For example, in intensive care unit (ICU), music therapy can abate stress response, decrease anxiety during mechanical ventilation, and thus induce an overall relaxation response without the use of medication. Besides, music therapy enables patients in minimal conscious state (MCS) to recover from coma more easily, and also improve patients with MCA, middle cerebral atrophy stroke, cognitive performance including verbal memory recovery and focus attention recovery. According to this positive outcome of taking music therapy, we can make a summary that music therapy does help patients with severe brain damage a lot. So next, I would like to introduce the gravity of worldwide dementia. By the chart, we can see the number of people suffer dementia worldwide will be 2.5 times in next 30 years, and the cost of dementia worldwide will be 2 times in next 10 years. Besides, we all know that we are facing an aging society. However, age and brain damage are both uncontrollable risk factors that may lead us to dementia. And this circumstance may cripple developing countries and destabilize our healthcare system. Therefore, I look into a significant cofactor in music therapy and dementia, that is brain damage. So here is music therapy efficacy to dementia. First, it can improve overall behavior and reduce depressive symptoms. Second, there's also an improvement in social and behavior ability. Last, there's a short-term benefits in decreasing anxiety level. In overall review, music therapy does help dementia patients against depressive symptoms. However, there's also research gaps including low quality evidence and lack long-term large sample study. And future studies should investigate more in cross-nation study and comparison of mechanism. In conclusion, Those results, combined with past studies, may help us figure out critical neurological and psychological cofactors that make difference in depression and dementia, and guide future clinical study and eventually enable innovative music therapy to improve dementia patients and its caregiver lives. This is my presentation. Thank you for your listening.